Welcome to Building Community. I'm your host, Donna Rodriguez. It's been 34 years since the CDC reported a rare form of pneumonia that was later determined to be the first published case of AIDS. Since that time, we've learned a lot about HIV, the virus that causes AIDS, as well as prevention and treatment. And today, Massachusetts is a leader in treatment and in research. In our episode today about HIV and AIDS, I'm joined by Sciortino, Executive Director of the AIDS Action Committee. Founded in 1983, AIDS Action Committee of Massachusetts is New England's first and largest AIDS Action Service organization. I'm also happy to have Marcia Richards as a returning guest. Marcia is a registered dietitian from Beth Israel Deaconess, Plymouth, who's also a staff member of BID's Access Program, which provides confidential HIV testing as well as health and wellness services to people living with HIV and AIDS on the South Shore. Thank you so much for being here today.
Thank you.
Thanks for having us. That's great.
We're really excited. This is our first episode of Building Community that we're talking about issues that impact our communities. And one of the reasons I wanted to invite both of you here today is I really found it interesting that we don't hear people talking about HIV and AIDS anymore.
No, it has it's still there, but some of the conversations are not as focused as they once were.
I think there's a lot of lack of attention. People think it's something of the past and it's something that was dealt with 15 years ago and they don't know much about it. Or if they think about it, they'll have some fear-based reation or some historic images and really don't have any context for what HIV is today. So I think it's part of our challenge, the work that we're doing, is to get the education message out there in a way that's relevant today too.
And I think that's so important because part of the conversation is prevention. And talking about it is education automatically.
Yeah, prevention, the messages are sort of lost right now. I did some work in some public schools recently and talking to students that had absolutely no health education, no sex education, and really didn't know the basics about HIV. One student said to me, HIV, that's like a blood thing, right? And just really no context for what it means or what it is anymore. I think we did better when people were more afraid, frankly, and as people have gotten less afraid, then the messages have been lost entirely.
Well, would you like to talk about where are we today? Where do we stand with HIV and AIDS in Massachusetts and locally in the South Shore?
As far as locally, I can speak to the Plymouth area. The Access Program is taking care of about 73 people and doing some informal needs assessment. We're calculated around 256 probably people that may or may not be in care. Our goal is to make sure that everybody who knows their status is receiving good HIV medical treatment. And for anybody that doesn't know their status, we want to encourage them to get tested to know their status, because that early detection means early care. And people who are in care with HIV will live as long as a negative peer. But we need to make sure that they're getting the help that they need. And that prevention message, making sure that we can educate people that it's a virus. And a lot of people are not getting tested because they don't feel they're at risk for it. So we really do encourage medical providers and everybody to have an HIV test if they've never had it, so they do know what their status is.
And you're encouraging people at this point too to make it part of your regular health routine every year.
Entirely.
Routine
add it
health
on to
screening.
your regular blood screening.
We pushed for state legislation a couple of years ago to make routine care more easy, removing some of the barriers and paperwork for HIV testing, and it really should be offered as a part of regular primary care.
Definitely.
I think part of the challenge we find with a lot of our clients at AIDS Action is they've encountered providers who may or may not provide the test, but they don't often know how to have a sensitive conversation around sexual practices and risk behaviors. So a lot of patients don't feel comfortable being out as gay or even talking about their risk factors in general about HIV. So often a lot of screening doesn't happen because patients and doctors aren't actually talking about their risks and thinking about it. And so the routine goal is really important, because if people aren't talking, you at least have to make sure that it's being offered.
It takes
regardless
away.
Of,
it takes away the stigma. If everybody is routinely being encouraged to have an HIV test, we're not putting everybody in their little pockets of, well, are you gay? Are you sexually active?
Are you using IV drugs? It's just
whatever.
This is part of our day-to-day health care.
You get your cholesterol, you get your blood pressure, you get your HIV test.
Until we get to that point that people really are comfortable, or our doctors are more and more comfortable broaching the subject on a regular basis with their patients, there are still a lot of places people can go for confidential testing.
Yes, they can. In Plymouth, they can come to the Access program. We have a wonderful HIV counselor and tester, and it is free, and we welcome anybody can call. Will you provide the phone numbers?
Yes, we'll provide all the information throughout the episode for folks to be able to contact you at the Access program, as well as AIDS Action.
Yeah, we provide HIV counseling and testing, confidential testing that people can come to if they want to have a more in-depth conversation as well. We have counselors on staff to actually help people think about their risks and manage those risks as well. But at the end of the day, people need to get tested. If you don't know your status, you can't get the treatment, and it's really a key that's been lost in a lot of conversations.
Yeah. And the great thing about getting tested through one of the organizations like we're talking about is that you get the counseling.
Right.
So it's a wonderful opportunity for us to provide education that, okay, we've done the test now, and what are the risk factors and how can you prevent transmission in the future? And that whole knowing your status is so important.
Is the first step.
Nationally, it's somewhere around 1.2 million people in this country are living with HIV today, but the CDC estimates roughly 15% of them don't know they have HIV. So at any given moment in this country, 15% of people have the virus, have no idea, they've never been tested. So that's really a challenge when people walk in and they may have had the virus for years, never knew it, didn't get on treatment, may have passed the virus on to other people, and meanwhile their own health has been degraded because of it. So the testing is really important for their own personal health and for the public health prevention aspects of it.
And Massachusetts, it really, I think, is an example in that respect, because our health care has been so comprehensive with people who do have HIV, that our numbers are showing very clearly when compared to the national, when you test and you're in treatments, you live a healthy life with HIV.
The phrase that we use a lot in the field is treatment is prevention. So if you're living with HIV and you're on treatment and your virus is basically suppressed in your body from the medication, you're less likely to pass on the infection to somebody else. In fact, if you're consistently taking your medication, the chances of you passing on the HIV virus is near zero at this point. It's really a remarkable transformation of science. Yeah, it's amazing, but that requires knowing your status and staying in care. And I think part of the challenge we have, and probably both of our organizations, for people with HIV, for some people, going to a doctor every 3 months, getting your labs done, taking medication every day is a simple thing, but for a lot of people, it's not. It's a really challenging virus to still manage, and it takes a lot of support and care when people are dealing with homelessness and mental health and substance abuse issues. We run into a lot of challenges, so our job is to really help stabilize them in lots of ways, because when they walk in the door at AIDS Action, their first priority may be, I'm homeless. Our second priority might be, I'm addicted to heroin, or I'm struggling with mental health issues and depression. Maybe the last thing on their list of priorities is, oh, I haven't gone to the doctor in 2 years and I'm not on medication right now. You have to get through those barriers before people can even talk about it.
Now, do you find differences in trends right now, or maybe in the last 10 years or so, with people who might not realize that they are at risk, that are the folks who are a lot of your new infections?
In the Plymouth area, one of our concerns has been the concept of late diagnosis, and that is when a person is diagnosed with HIV and then gets an AIDS diagnosis within 2 months of that initial. So what that comes down to is they've been infected for a long, long time, and we don't want anybody to get an AIDS diagnosis at the same time as their HIV. So that late diagnosis, I think it's getting a little bit better, but the data is still pretty high. In our program, about 15% of our clients have a late diagnosis. So another important reason for testing, that the earlier a person is diagnosed, if we can keep it as an HIV-only diagnosis versus advancing to that AIDS diagnosis with medication, with care, is really important.
I think that's really key, and it requires people to be even talking about HIV, which is why I'm glad you're even having the space for this conversation, because if people don't talk and don't educate, they don't get tested, they don't prevent, which means they come to care late and they have an AIDS diagnosis. But I think one of the things that hasn't changed in the last 34 years in some ways is people's perceptions of who is at risk for getting HIV.
Good point.
Means that people that are at risk don't think they are. So people assume, oh, it's just those people. Whoever those people is in their mind, it's somebody else always.
It's behavior, it's not personality.
It was originally called the gay plague or the gay cancer, and people thought, okay, it's not a gay disease, we have to educate that. and it's true. It doesn't discriminate. It doesn't care if you're black, white, Latino, gay, straight, man, woman. It doesn't. It's a virus. It doesn't care.
It's a virus.
It doesn't care.
know.
It's the virus doesn't care.
It really doesn't. And yet, we still see certain communities that are disproportionately impacted. So in this state, the numbers for, in particular, young black and Latino gay men are rising faster than any other population. But they're not the only ones getting infected today. It really runs the gamut: age and race and sexual orientation. It's pretty remarkable to see that still in place.
I had been hearing that there were even numbers that the seniors were having rising incidences of new infections.
Yeah, I think Plymouth County, I think it's like roughly 27% of the new diagnoses in 2012 were in people over 50. So that is another age group that we haven't done a really good job as far as prevention. And many people, as they get a little bit older, maybe kids have grown up and they're leaving the nest, or people who haven't been in relationships are ready to enter into a relationship and they don't understand the concept of safe sex.
And that the climate has changed so much.
It has, yeah, it has. And it's something that we really need to work on, because I know in Plymouth County, the highest rates of those infected is among heterosexual sex, presumed heterosexual sex, and this other category called undetermined, which can equate to heterosexual sex. And that's one of the groups of people sometimes that's not thinking that they have to get tested.
And there's so much more we need to talk about. This is just the very beginning of our conversation, but we're going to take a brief break, and when we come back, we're going to be talking more about HIV and AIDS. Thank you for joining us for Building Community. Welcome back to Building Community. I'm your host, Donna Rodriguez. In our conversation today about HIV and AIDS, I am joined by Carl Sciortino from AIDS Action Committee and Marcia Richards from Beth Israel Deaconess, Plymouth. Before we went to the break, we were talking about the importance of early detection. And we talked about some of the things that might prevent people from being tested, some misperceptions. Do you think there's still an issue with stigma around diagnosis for HIV and AIDS?
I do.
I think it's really strong. I've been living with HIV myself for a little over 5 years, and it's remarkable people's reactions and misperceptions and fear. Even just talking about it openly, and for myself to be able to tell people was a really, really scary thing, because people have lots of weird reactions and don't know what to do with it. I think it's different than it was 30 years ago. You don't see the same kind of
fear?
No, you don't see the same sort of blatant discrimination usually, at least in this state, but it still is very pervasive in the way people are handled and treated. And we had a client most recently that was outed as having HIV to her entire family in a hospital setting. and really lost a lot of people in her life because of it.
Wow.
It's still, people have a lot of fear around it. It's still there.
What do you think, what are the steps we can take to move away from that?
I think it's talking about it. I knew no one when I got diagnosed that was openly living with HIV. It was just something that people now, because the treatments are so much better, people can live a private life and live a healthy life with care and treatment, but that means a lot of people are just not visible, so there aren't quote-unquote role models of people that are out and visible, which I think is unfortunate. So it makes people more likely to be secretive. I know a lot of people that have HIV that would never tell a soul, not because it's just out of privacy, but really out of fear of reactions.
The reaction that people might get.
Is that what you hear from your patients as well?
Yeah, our patients, run the gamut, that some are very open and honest about it and work as advocates and help provide support for people, and others are, nobody in their family would know because they are very concerned about the reaction that they would get. So just giving us an opportunity to talk and informing people that it's a virus, that's it. It's a virus. And we want to prevent it, but people are people. They're still the same.
So talking about the virus, talking about the importance of early detection, of testing, of making it part of our regular health care, all of these things, I would think, make it an open conversation, which ultimately, hopefully, will help to decrease some of the stigma.
Well, I think also for people that have the virus to be open about it in safe context is important to give people space to do that in a thoughtful way. I know when people are newly diagnosed, it's still a lot of, even though the treatments are better, people don't know what that really means. So when they're diagnosed, they're still afraid, does this mean I'm going to die early? Does this mean I'm going to have a bad quality of life with side effects? And the answer is people can live a long, healthy life with almost no side effects now with great care and support that's out there.
Definitely.
But you have to address those specifically with people and really hold their hands through that process and let them find the space in their own lives to be comfortable with their status, comfortable with their diagnosis, and healthy, and realize life does go on, and I can be open with people that I choose to be open with and live my life.
And that's what living with HIV is all about. You're living.
You're living a healthy
it.
life with HIV.
Oh, definitely. Yeah.
Now, it used to be, even just in talking about medications, the amount of medications that were needed for somebody to be healthy and keep the virus levels down in their body was unbelievable. But today it could be just as simple as a single medication.
One pill a day.
One pill a day.
People have this perception of fistfuls of pills and 5 times a day, with and without food, and really bad side effects. And that really was the case for a lot of those medications. But even in the last 5 years, the options have expanded. So now there are several regimens that are just 1 pill a day.
And well tolerated.
Well tolerated.
Yep. Very few. I think there's only one that I can think of that is even food related, which is simple enough. You have it with breakfast or supper or lunch. You can take it anytime during the day.
Any antibiotic or any vitamins.
Same kind of thing.
I listened to a doctor do a presentation about the history of how the treatments have evolved over the years, and he's told the history from when it was nothing to when it was just AZT to when it was all these really toxic combinations. And he said, now my patients come in and they say, doctor, I want a purple pill. I want a pill that matches my outfit today. We have so many options. People can sort of be a little bit humorous about it now. Yeah, it's really remarkable.
And now there's something available for prevention as well. Can you tell us a little bit about PrEP?
PrEP, so pre-exposure prophylaxis, stands for PrEP. Prophylaxis is a preventative, like a condom is a prophylaxis, or people may be familiar with prophylaxis for medication purposes, like people would take anti-malarial drugs to go into certain places as a preventative. There's now a regimen that's FDA approved. It's 1 pill a day. It's an HIV medication that people who are not infected would actually take every day, kind of like birth control for HIV. And if they are exposed to the virus, but they have taken the medication every day, they don't actually get infected. It's new. It was just FDA approved 2 years ago. So people that are at some risk for HIV should really learn about PrEP, because it could be the thing that keeps them from getting infected. And
that's what I was going to ask. Is it something recommended for everybody, or specifically people who might be at higher risk?
I think more for people who are at higher risk.
Yeah, the CDC has some guidelines that make it clear that it's for people that are at risk for HIV infection, but it's pretty broadly defined, and if people aren't sure if they're at risk, it's all the more reason to go get tested and talk to a doctor and learn about what their risk factors might be. it's not just meant for gay men. It's not just meant for IV drug users. It's really meant for people that are at risk, and it's so new that people don't even know about it.
It could be somebody, a married couple, one member who is HIV positive and the other one who isn't. It could be any type of situation that could put somebody at risk.
And it's something that people don't have to take their entire lives necessarily. Kind of like birth control or contraception, you may have a period in your life when you're more sexually active or more at risk for acquiring HIV when you'd want to take PrEP, and then if you're in a different state in your life, you could stop taking it. The good thing about that is in that time period, if you're on PrEP, then you don't get infected, and then you don't have to stay on medications the rest of your life if you actually acquired HIV. It's a game changer. It really is.
Things have come so far. It really is amazing. And they're even talking about their medications being tested now. They're looking at decreasing the virus in people who are already positive. Do you perceive in the near future that we're going to step over that next line medically?
I hope so. We don't have a cure yet. No. We have lifetime of medication treatment. We don't have a vaccine yet, but we do have PrEP, which is more effective than vaccines, but it takes a pill a day. Yeah. It's a step in the right direction. The science around HIV has made remarkable progress.
Amazing.
And I have hope that in my lifetime I can get cured and move on with my life from this stuff, but we're not there yet. So I think it's really remarkable to see the science progressing, but we have more work to do.
Most definitely. And there's so much that AIDS Action does in addition to education and legislative advocacy. We'd like to talk a little bit about your additional programs.
Sure. So we run a whole range of both support services for people living with HIV, similar to the work that you're doing at Access. We do housing, case management, legal services, basically whatever barrier someone that has HIV might have to getting into care and treatment and staying on care and treatment. We try to give them wraparound services to keep them in care, keep them stable. But we also have a whole range of prevention services. One of the most important ones right now is the needle exchange program, where we do overdose prevention work. We've all been hearing about the opioid addiction crisis and lots of overdoses. Our agency last year alone, just our agency, had 120 overdoses that we reversed with a medication called Narcan, which is a nasal spray that reverses someone in the middle of an overdose. It's 120 people that would otherwise be dead today in the state without that program.
In one agency, in one location.
Just our agency.
It's unbelievable.
And the opioid crisis is really frightening right now. I think the numbers of overdoses are growing pretty rapidly. It's a problem. The good news is, in terms of HIV, actually, is the needle exchange programs have worked. The number of people getting HIV from needle exposure, from IV drug use, it's gone down to 6% of new infections. It's so low, it's like, you can see it's getting to zero HIV transmissions for needles. It's remarkable.
And AIDS Action, wasn't that the first agency in Massachusetts to do a needle exchange program?
I don't know if we were the first. We're one of 5 communities now. There are up to 10 allowed in the state, but many local communities have blocked needle exchange, which I think is really damaging, both for those that need the services for needle exchange, but also for the overdose prevention work that happens in that space. So we're really calling on the state to expand access to needle exchange around the state, because in the opioid crisis, it's really the front lines of where people are accessing the services, and we can literally save lives like we are at AIDS Action.
Now, you also, just in the last few years, you also connected with Fenway Community Health. Is that correct?
Yeah, Fenway Health is a community health center. So AIDS Action doesn't provide direct medical care. We do all the support services, advocacy, and prevention work around medical care. And then we partnered with Fenway Health so that we have some of the best clinicians really in the world who do HIV research and treatment that we can partner and connect our clients to every day. It's a great partnership.
Now, for folks who are in this area receiving care from the Access program, can they receive, excuse me, care advocacy from both organizations?
Yeah, I think
Is that
we
an
have
option?
a few collaborative relationships in different areas. At Access, we've got 2 separate funded programs. One provides medical care, and that's funded through Ryan White Part C. Our other program is funded through Ryan White Part A, and that's medical case management. So similar to what AIDS Action is doing, we want to provide that comprehensive care, that we can provide you with the medical care, but we also need to support the transportation that you need to get there, or make sure that you do have insurance, make sure that you're housed. We do some occupational, not recreation, work type things. If people wanting to get back to work or further their education, our 2 case managers are phenomenal in helping that process. So we're able to provide comprehensive care, and then we collaborate out with all of the available organizations to make sure that all services are being received. And, you know, I think we all are pretty good about sharing the wealth.
At the end of the day, it's about the clients and their needs and getting them healthy. I think the HIV world is really good that way, where we're not looking at turf, it's really looking at the clients and what their needs are, and how do we keep them in care. That's the end of the day.
And a very holistic approach. It's not just medication, it's not just physical, it's the whole person.
Everything, and the family too. You know, we reach out to the entire family.
The investment is worthwhile when you think about HIV. It's an infectious virus. It's a public health issue. So by investing dollars to keep people in care and on treatment and virally suppressed, with whatever it takes to get them to that place of viral suppression, it means that they're not able to pass the virus on to other people as well. And that's, for public health purposes, really worth the investment.
And you also do a lot of work with raising funds to be able to support the work you do. And you are coming up, is this the 30th?
The 30th AIDS Walk this year.
30th AIDS Walk, that's
June
amazing.
7th, Sunday, June 7th. Yeah, it's amazing.
Time flies.
We'll be going back to the Boston Common on June 7th, where the walk started 30 years ago. And part of it is to tell the story of how far we've come in 30 years, and part of it is to tell the story of what the challenges are that remain today. And it's a remarkable event because you get 10,000 people together raising funds, and more importantly, in some ways, raising awareness. It's New England's largest HIV awareness event that we have every year. And Sunday, June 7th, I would encourage people to go to aidswalkboston.org and check it out and sign up and come to the walk. It's a beautiful day.
And even if folks aren't able to walk, they can still go because you have a whole health and wellness pavilion, don't you? So there's a lot of information.
There's a festival, there's entertainment. I've been to many walks from many different organizations and charities and things, and I'm biased because it's for AIDS Action, but we really have one of the best out there. It's a fun experience, great, free food, entertainment, but it's also a chance to, people have friends and family members and coworkers that might know nothing about HIV, and just getting people there and having a little moment to say, it's still with us, it's still here, there's still people living with it, there's still people that need to get the prevention messages. It's a chance to do that on a large scale. It's really remarkable.
And it's a chance to, as you said, call attention to the fact that we still have work to do.
We still have work to do. I think of it as we're at the final phase of the epidemic. We're at the beginning of the final phase of the epidemic. The first phase was people were facing a death sentence.
It was tragic.
The second phase was people were struggling to manage a chronic condition with really challenging medication regimens and trying to figure out how to transform from a death sentence to a life option. And now it's, how do we get to zero new infections? How do we get to zero AIDS-related deaths? How do we get to zero discrimination from HIV? And we can see that on the horizon. That's our goal, is to finish the job and get to zero.
And I do hope we have the opportunity to see that in our lifetime.
I think we will.
I'd like to thank both of you so much for joining us today.
Thank you.
It really has been a wonderful conversation. We really appreciate your time and looking forward to doing more work with you moving forward. And we'd like to thank you also for joining us for this episode of Building Community. In our next episode, we're actually going to be continuing this conversation. We'll be talking with staff from Beth Israel Deaconess's Access Program, and also with a local resident who is living with HIV. For replay times, resources, and more information, visit PACTV.org. And if you have show ideas, comments, or questions, please email us at buildingcommunity@pactv.org. Thank you.